Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in to another episode of my fantastic global virtual clinic, which we run every Wednesdays, Fridays, and Saturday. At the same time, that's 9:30 Greenwich Mean Time, 1:30 Pacific Time, or 4:30 Eastern Time. If you're new to the channel, welcome. I'm Dr. Khaled Sadek, your host for today. Let me just adjust this camera. It's a little bit high. Let's pop that there. So, if you're new to the channel, welcome. For those of you who are familiar, I specialize in the removal of cysts and lipomas, and you can find my work on my YouTube channel. You can also get hold of me at lipomacyst.com. So if you've got any skin complaints and you think we might be able to help, then reach out to us at lipomacyst.com. You can also find educational material at drkhaledsadek.com. I'm also present on all the social media platforms. So you can find me Facebook, Instagram, and Twitter. So today is our global virtual clinic. As we say, we run this 3 times a week where we field questions from our viewers. So if you've got any question, not just skin, any question at all, and you want me to try and assist and help and guide you and signpost you on how to seek answers, then feel free to write it in the comments. And we'll try and get through as many comments as we can in the 20-30 minutes that we've got this evening. Today, we also use this the virtual clinic to also describe the videos that have been released and the videos that are going forward. Now, the last couple of videos, we've had the Scaramanga cyst, we've had epidermoid cyst, we had the juicy shoulder cyst. Thanks so much for watching those. In the next clip, it's a clip I think everybody has been waiting for, and I think you're going to have to wait a little bit longer because it's a big file. So we're uploading that onto YouTube as we speak. So it won't be out straight after the global clinic. It'll be a little bit after that. So hopefully in the evening sometime, wherever you are in the world, you'll be tucking in to what is literally the largest pilar cyst ever. And the hesitation behind releasing it is because of a number of reasons. One, the camera angles are 50-50. We've got the dual cam, but the graphic, a lot of my surgery doesn't involve a huge amount of blood or gore. So this one's a very much more graphical content. So beware when it is released. It's also a celebration of our verification on YouTube. So we finally got verified on YouTube as being a real person. So that's good to know. But what this means is we can release videos now that are longer than 15 minutes. So I think the massive pilot cyst is a 22-minute video. So the longest video we've ever released. And that's really to celebrate our verification on YouTube. So it's taking a bit longer to release. It won't go straight out after the live chat, a little bit short time afterwards. Hopefully you catch it. Remember, it'll definitely be on there by tomorrow, if not today. So let me know how everybody's been. Hope everyone's okay. I know around the world, we've got viewers around the world, and everyone's sort of struggling either with coronavirus, with rioting, with hurricanes, with flash flooding, with hot temperatures. So let me know you're all safe. Wish yourselves a lovely evening. So we'll start off by saying hello to all of our viewers. Let's crack on. Let's see who we've got in the house. Let's see who's number 1, who checked in first. Great turnout today. Thank you all so much for joining me today. I can't do this without you. So we do our podium positions as we do every global live chat. So in at number 3, Elsa Vieira. Welcome, bravo. You've got the 3rd position on the podium. 2nd position, Gibby's wife. Welcome. But in at number 1 is Anne Brooks. She got that platform. She got the podium, 1st position. In 4th, we've got Sid G. Hello. She's saying everyone, Syndico, greetings to everyone. Jay Corwin, how are you doing? Hit the thumbs up, even though it hasn't started. That's what I like. Jay, that is the attitude. Hit the like button before it's even begun because you know what to expect. It's going to be good. It's going to be a good chat. It's going to be a great pop. So, who else we got? Sandra Flynn, how are you doing? And she's finally caught us going live. So Sandra, if you've got questions or if anyone's got questions about any medical topic, then please ask. Sandra Kaywood from Maryland, United States. How are you doing, Sandra? Anne Brooks from Riverside in California. Marsha Thompson, how are you doing? Have any of you started waving to the screen? Absolutely. Everyone should be waving. One of our viewers has recommended that we produce a GIF of a wave. So we're going to try and work out how to do that. Bridget is at work, but she sends her greetings. Oh, we may have missed Bridget today. Anne Brooks, can you suggest anything to eat that will preempt mosquitoes from attacking? Ooh, that's a difficult one. I think your mosquitoes, if you're going to a malaria zone, then make sure you take your malaria tablets, and they can come in two forms. You've got your old sort of old school doxycycline, and you take those, I think, 7 days before you travel. Every day you're there, and I think 2 weeks after you get back. It's a much more protracted course, and it's doxycycline, so you can't have it if you're exposed to sunlight too much, because it causes photosensitivity of the skin. It causes diarrhea. It's not very pleasant. So the new kid on the block is Malarone, and I think you just kind of take that 2 days before you travel, and I think 2 days when you get back. But check with your pharmacist for more information. So that's the malaria aspect of mosquitoes. And then obviously you should have that netting, the fine netting, and some DEET spray, I think it is. But I don't think if you eat like sardines or I don't know, something smelly like Swiss cheese, it's going to make the mosquitoes less attracted to you. So I don't think anything you can eat can do it, but definitely get your netting up nice and early. Sherry, how are you doing? Marion, hello, and all the Sadekis, absolutely. So I like this, the Sadekis. So we were thinking of names to call the group. I think there was the Khaledets. So that's nice. Sherry, welcome. I was afraid I'd miss the live chat today, my first day out after quarantine. Oh, well, glad you joined us today. Gail Sharp, getting ready for a global clinic. It started to look dark and rainy in East Texas, and that's the effects of Hurricane Laura. I heard that's going to be really, really heavy, so make sure you stay safe. Do everything you need to do to stay safe. Ohio is also dark and stormy. Joyce Bauer, please try to stay safe from the hurricanes. It sounds like there's a lot of hurricane season coming into the States right now. Took a friend out for a birthday for East Texas. Awesome. Let's have a look. Who else have we got? Sandra Flynn, let's have a look. Bridget's here. Welcome. Linda Nelson, welcome. Let's have a look. Joyce Bauer, how amazing is it to be united from all around the world? Wow, that's awesome. Thank you so much. Kim Havalon, welcome. Sula Lally from the United States, welcome. Jasmine Martinez, welcome. Dana Stewart, welcome. Is there anything but fat in a lipoma? That's a good question. For the large majority of tissue structure, it's going to be fat. In very, very rare cases, you can get some blood vessels in there or some nerves. And in very, very, very small numbers, like 0.1%, you get like an adenosarcoma, liposarcoma, which is a neoplasm, but not an abnormal malignant growth. So the majority is just fat. Jasmine Martinez loves the videos. Dr. Sarah, our resident orthodontist, is in the house. Welcome. Delana Hammond, how are you doing? Welcome. Melody Staskovic, how are you today from Minnesota? Welcome, Minnesota. Tammy Keefe, how are you doing? How do you treat delusional parasitosis? I'll have to get back to you on that one. Ursula says, I'm calling from the United States. I had a cyst on my left cheek removed, left a pink scar. Now I have another one, and it's deep and sore. So yeah, invariably when you cut the skin, there will be a small scar, which may or may not fade with time. The pinkness is because the skin is very, very fresh. It's very new, it's juvenile skin. And so you can see the fleshy blood vessels underneath it. With time, the pinkness will go away. So that should settle. Jasmine Martinez, I have what looks like a cyst or a lipoma under my foot. Can you get them then? That's interesting. It's a very unusual place to get a cyst or a lipoma. If you're feeling nodules on the sole of your foot, you've got to be thinking about Morton's neuroma or some sort of tendonitis. So I would go more with like a tendon issue, and I'd probably get that ultrasounded. You can also get Ganglions, we've spoken about ganglions in the past, and that's fluid from the synovial pouch that and causes a ganglion. So, but not a cyst. Dr. Sadek, says Kim, I've got a question, and it's about spondylolisthesis and still having tremendous pain when walking. I get relief when I lay down on my side. Can this be fixed? You know what? I think we're going to be bringing in one of our spinal surgeons, and they can definitely talk to you about this. But in terms of pain control, you got two forms. You got your opioid-based pain control, so you got your codeines, your dihydrocodeines, your tramadol, which may or may not help. And you've also got your neuropathic agents, so your nortriptyline, your amitriptyline, your gabapentin, and your pregabalin. So it depends what kind of pain it is. If it's sort of a mechanical pain, like the spine, a bit of arthritis, a bit of degenerative bone and joint, then it's going to be more of the codeine, the opioid-based painkillers. If it's going to be the nerve entrapment, which it could be because when you say you rest, eases up, then you're going down the neurogenic pain control. So that's the nortriptyline, amitriptyline, the gabapentin, and the pregabalin. So you've got to speak to your local physician about those. Okay, let's have a look. Tonya Hatfield from Indiana. She's giving us a massive, massive shout out. And everyone is wishing us phenomenal success with the verification. Jan Decent, I had 8 cysts underneath my arm. And that's about 1980. And it was very, very sore. And my GP does not want to have x-rays done. What do I do? Well, look, cysts under the armpit can be for a number of reasons. Number one, we mustn't mistake them for being lymph nodes. Now, lymph nodes are like the barracks of the immune or a disease process. Then the armpits have a lot of these barracks of the immune system, and so they will localize there. So one, we've got to make sure that is it a lymph node or is it a cyst? And one way to find out is you can do a blood test or you can do an ultrasound test. And part of the ultrasound test might be what we call a fine needle aspiration, so an FNA. So that is to kind of take a sample of whatever is causing those lumps and sending it off to the lab. There are, of course, certain conditions that affect the axilla, the armpits, that are skin cysts. And if you're not happy with what your physician has said, then seek a second opinion. Absolutely. I think X-ray might not be the imaging technique that you would require. I'd probably go for an ultrasound and a blood test. But again, it's difficult to say having not seen it. But I hope that was useful. Kelly from Connecticut, welcome. Lindsay Wilson from Scotland, how are you doing? A little bit rainy. Linda Griffin from Austin, Texas. It's Laura, B83, how are you doing? Painful boils under my arm. Yeah, so the boils, they can, you get all these kind of massive boils underneath the armpit. I usually go for a long course of a tetracycline, like a limacycline, and you can double the dose for that. You can drain them individually, but they do tend to form. Let's have a look. Thapi Letsuala from South Africa, welcome. She's in the house. From Harlem, New York City is Jasmine Martinez. Sandra Flynn, I have gel injections into my ear and into my knee. What are your thoughts? Yeah, well, there are these gel injections, these kind of synthetic synovial substitutes, and they're really there to kind of pump up the joint so that it doesn't kind of grind to a halt. So it's used in osteoarthritis. They are okay, they're useful, they do give some benefit, but they're not long-lived. You keep having to have top-ups, and then with every top-up there's the added risk of infections. So they're okay in the short term, but ultimately we need to find a resolution to it, and that might mean surgery, that might mean a knee transplant, knee replacement. Edwina Kemp from Canberra in Australia, welcome. It's cold, -4. Please tell me how hot it is where you are. Well, it's a bit rainy in the United Kingdom, but I think in some of the states it's pretty hot, although they've got hurricane season, so maybe no one's got any sun. If you've got sun, let me know where you are and what country. Mary Wolf, hi Doc, welcome. Judy Green, hi there. Since my C-section 2 years ago, I have a large inflamed spot similar to cysts on my scar line and inner thighs. Any advice would be appreciated. Well, this is quite interesting. So the cesarean section scar is usually flat. Invariably, it's flat, but which they have to close it up. Inflamed spots on the line itself, well, it's difficult to say. I mean, one, it could be keloid scarring, you know, so that's where there's hypertrophic scar formation. That means excessive skin growth along that ridge, and you get that kind of like that ridged appearance. So we've got to distinguish about, is it like a keloid scar, or is it actually a cyst? If it's a cyst, it should be relatively straightforward. A matter of putting some local anesthetic, opening up, draining it, and then curetting the inside so it doesn't return. And you can see that in a lot of the videos that we've done. But again, I'm happy to take a look. lipomas.com. Let me tell you what it looks like. Prince of Zam, how are you doing? How are you doing? Irani, how are you doing? Sulalali, Doc, I hit the like button and only would like to remind everyone to hit the like buttons, and if they're not subscribed, subscribe and leave a comment. Thank you, Sue. I love the housekeeping. Absolutely amazing. Terminator T800, welcome. Marion, I have a fracture on my T12. It's really painful when I stand. Would physio help? I think if you've got a crush fracture, as we call it, then it involves a number of things. T12, for those who aren't aware, it means at the thoracic level vertebrae 12. So it's right at the bottom of the chest, kind of like in the middle of your tummy. And it's most likely to have been caused by a column of pressure on that last vertebrae, and it's just kind of crushed it. Very common, especially as we get older, the bone density gets weaker and you develop osteopenia. That means a lack of mineralization in the joint, in the bone itself, because the skeleton is a massive reserve of calcium, and if your body needs the calcium elsewhere for the signaling of muscle contraction, then it will take that reserve from bone. So as we age, the bone gets thinner because we need that resources elsewhere. And there are also some changes, especially in women postmenopausal, that causes increased bone absorption. So osteopenia is the first step. That means that there is going to be a progression to a more severe state called osteoporosis. And that means that the bone density has got to a level where you might sustain fractures, either through low impact or crush fractures. If you're worried about your bone density, then the first thing to do is get some imaging, and that's called a DEXA scan. And a DEXA scan is you lie down on this bed, and this kind of like this arm comes across your body like this, and it does an X-ray of your entire body, and it gives us a picture of your skeletal system. But more importantly, it's able to quantify how much density is in each part of the body. So the most common places that we have breaks are in what we call the neck of the femur, so your hip. So it gives us a number of how much density is in the hip. It also tells us in the vertebrae. Like I said, the thoracic is a bit high. Normally it's in the lumbar spine, so like the L3, 4, and 5. That's where you typically get these fractures. But again, it'll give you a score, what's known as a T-score, and your local physician will be able to tell you how much risk you are. And if you need extra assistance, then obviously vitamin D and calcium supplements are your first port of call. But there are lots of other medication that try and strengthen up your bones called bisphosphonates. And you can speak to your GP about them. You know, they come in either tablet forms like alendronic acid, or there is an injection called denosumab. So if you're worried about fractures, then DEXA scan and vitamin D, the sunshine vitamin, combined with some calcium supplements, will try and reduce that process. So I hope that was useful. Joyce from Alabama, welcome. Welcome. Garlic is the way to get rid of them. Brilliant. Bruce Davis from Portland, Oregon, welcome. Joanna, Dr. Sadek, good evening. I hope you're enjoying the show. Awesome. Thank you. Thappy, is snail cream good for dark skin? I'm not sure what snail cream is. Is that the stuff that they leave behind? What is that? What is that? Penny Bowers, moles. I get removed. I get the moles removed and they come back. Why? It's a good question. I mean, the reason that we get a lot of skin issues is because we have a lot of skin. There's a hell of a lot of skin and we shed it like there's no tomorrow. So that means your body is constantly having to produce new skin. How does the body produce new skin? Well, it's got a massive encyclopedia called your DNA. And every time it wants to create a new piece of skin, it turns to the chapter called skin production and it reads the text. Sometimes they miss a letter and sometimes they miss a word. So the skin they produce has little errors in it, and freckles, skin tags, and even melanomas are part of the error process that happens when the body reads that genomic sequence, that DNA sequence, when it produces fresh skin. The skin is particularly prone because we've got a lot of it and it's constantly being reproduced. Anything that has got a high turnover, you're going to find a lot of errors. Okay, hope that was useful. Kelly from Connecticut, Jamie Kraus from Texas, welcome. Sid G, studies say mosquitoes are most attracted to blood types. Interesting. Laura Doan from Kentucky, welcome. Who do we have here? Johnny Martinez, welcome. Marsha Thompson, how are you doing? Trekkies. Kelly, welcome. Lindsay Wilson, welcome. Debbie Fernandez, can a lipoma put pressure on the nerve and cause numbing and tingling? Yes, absolutely. If it's in the right place, doing the wrong stuff, you can get nerve issues with lipomas. So that's definitely something. Princess Am, spondylolisthesis can definitely be fixed, but make sure you optimize medical therapies first, just like Dr. K said. So Princess Am, they've got some information there on spondylolisthesis. If you've got any more questions, make sure you pop it in. Lizzie, what else we have in the house? Linda Gaskill, greetings, doctor. Greetings. Gail Marie Reynolds, good afternoon. Southern Jersey, welcome. Margot Golliford, welcome. Wet Gales. Jasmine, how are you doing? Dharma555, Deb Rose from Lebanon, Pennsylvania. First time watching. Awesome. Welcome. Let's see who else we got in the house. Carla Johnson, Penny Bowers, Moles. I think we spoke about that already. Christiana is in the house. Welcome. I got sun in my heart. Welcome. Sevilla Nagy, how are you doing? I'm doing very well. Welcome. Margaret Bruce. She's loving the show, loving the information, and she's staying tuned. Awesome. Welcome. Joanna A. This afternoon was sunny in Manchester. Oi, welcome. Awesome. Let's see what else we haven't. Any questions? Let's scroll through. These global clinics are such a brilliant idea. You're so good at explaining conditions. Thanks for sharing, Dr. K. That's from Dr. S. Well, yeah. Are we reading the same stuff over again? Let me scroll down. There might be a glitch. So let's have a look. Jasmine, how are you doing? Let's have a look. Christy Rowlings is welcome. How are you doing? She's welcome everybody. So that's the end of the show. I hope everybody enjoyed it. We will try and release this massive pile assist in the next 30, 40 minutes, maybe an hour. Bear with me with slight technical glitch because it's such a big file and it's a celebratory file. So remember, today's Wednesday, it's a hump day. So we're going to get this pile assist through and so that we can see you for an awesome blackhead on Friday and a compilation and a blackhead on Sunday. So remember, if you haven't subscribed, hit that subscribe button. You'll catch me again Fridays and Sunday at 9:30 Greenwich Mean Time, 1:30 Pacific Time, 4:30 Eastern Time. Until then, take care. Bye-bye, everybody.